morning, everyone. My name is Dustin Klein, Publisher and Chief Content Officer of Smart Business. On behalf of Smart Business, it is my honor to welcome you to the 2021 Medical Mutual Pillar Award for Community Service Recognition event. Each year, we come together to honor organizations and individuals whose efforts have made a significant impact on people's lives by giving back. We're so pleased to have all of you join us this morning, especially since we've been able to pivot to a virtual conference during these unprecedented times. It's heartwarming to continue to bring people together who share a common belief that by coming together and giving back, by reaching out a hand to our fellow man and woman, that we can strengthen the communities where we live and work. Right now, this is more important than ever. The truth is that everything each one of us does makes a difference, no matter how large or how small. Now, before we get started, I'd like to take just a few moments to thank our sponsors. They not only support the very tenets that this program is based upon, but they also demonstrate in their actions the same commitment. First, this program would not exist without our friends at Medical Mutual, our founding and title sponsor. Their commitment goes beyond mere words. Medical Mutual transcends its role as a healthcare insurance company, and instead is a dedicated partner to this region and its residents. So thank you, Rick Chiricosta, Amber Hume, Andrea Hogman, Christine Taylor, and your entire team for your continued support, not just of this event, but of the entire region and state of Ohio. Next, we want to thank our friends at DigiZoom. Whether it's bringing a brand, value proposition, or organization's culture to life, DigiZoom's team accompanies its award-winning visuals with carefully crafted scripts that support messaging objectives, engage audiences, and inspire action. So thank you, Richard Stewart and DigiZoom. And also, thank you to our friends at Ohio.net. They are a leader in internet-based technology, offering VoIP phone service, internet access, network security, and co-located data center services. With a rich history here in Ohio of more than 100 years, Ohio.net continues to support the communities where it operates. So thank you. Now, as many of you know, we started the Pillar program back in 1998 with our co-founding partner and title sponsor, Medical Mutual, to recognize companies for giving back to the community. This is the 23rd year of the program and the 12th year here in Central Ohio. We truly miss being able to present this year in the State House as we have done each year for more than a decade. But like everyone, we've adapted and look forward to being back there in 2022. Now, in addition to recognizing for-profit companies for their corporate philanthropy, we also recognize and honor individuals who run the nonprofit organizations that do great deeds throughout this region. We recognize the individuals who serve on their boards and donate their time, their talent, and their treasure to causes they're passionate about. And we recognize the individuals for whom philanthropy is simply part of who they are. Now on the screen, you can also see a sampling of the nonprofit organizations that have been supported through the Pillar Award program over the years. And we really appreciate the ability to do so. Today, we recognize 20 honorees with Pillar Awards, a combination of organizations and individuals. Nominees for this year's Pillar Award were judged on numerous pieces of criteria, including an organization's overall philanthropic efforts, such as financial, pro bono, and volunteer contributions, involvement on the boards of nonprofit organizations by their company, a nonprofit executive's ability to successfully lead his or her organization towards successfully delivering upon its mission, and an individual's personal commitment to community service and giving back. During this morning's program, on video, you're going to hear from individuals and organizations being recognized about what giving back and this special tie between the for-profit and nonprofit worlds means to them. So now, on to the awards. To present the first one, please welcome from our friends at Medical Mutual, Amber Hume. Amber?
Our first award is the Medical Mutual Share Award. The heart of Medical Mutual's charitable giving lies in the Employee Volunteer Committee SHARE, which stands for Serve, Help, Aid, Reach, and Educate. This was an unprecedented year. Many of us witnessed and experienced firsthand stress, uncertainty, loss, but also hope and inspiration to help others. And though we couldn't be together, we found creative ways to give back. At Medical Mutual, our employees embrace numerous social distancing and virtual volunteer opportunities. They made online donations to nonprofits across the state and even used Amazon wish lists to help collections for children and families in need. More than a decade ago, we started a special award in honor of this group to recognize organizations where their employees are the drivers of the community services. And so we are honored to present this year's Share Award to Grange Insurance. In 2020, Grange and its associates provided nearly $2 million to financial support of over 100 nonprofit organizations. This amount doubled last year's financial contributions. The insurance provider and its more than 1,200 team members' multifaceted community relations program included financial support, volunteerism, nonprofit board participation, and in-kind donations. Team members served as the core of Grange efforts. Grange also honors associates' commitments to serving by offering paid volunteer time and matching financial gifts through the Grange Insurance Gives Foundation. These efforts fuel economic prosperity, improving the lives around us and creating sustainable solutions. When the COVID crisis hit, Grange reimaged its corporate volunteering program to offer the benefits that come from volunteering while keeping associates safe. Beyond that, Grange recognized the need to act with fierce urgency to support nonprofit partners and the people and communities hit hardest by the impacts of COVID-19. So in May, the company announced it would contribute an additional $1 million to local nonprofits to support health and human service response efforts to the COVID-19 pandemic. Congratulations, Grange Insurance. Priscilla, congratulations. I am so honored to sit down and talk to you about all the great things Grange is doing.
Thank you so much, Amber. And we are so excited and pleased that we are receiving this recognition. I know there were probably a lot of applicants and, for Grange to be selected, we are just overjoyed.
Well, great. Well, let me first by asking you, we heard a lot about you re-imaging a team-oriented philanthropy and just wanted to know how you did that during these trying times.
Sure. So I'll mention, obviously, I have a lot of examples, but I'll just mention a couple in terms of how we have reimagined our team-oriented philanthropy as a result of COVID. So we have about 1,200 associates, and they are so dedicated around going above and beyond, to support our community. One of the biggest ways that we reimagined a team-oriented approach is through our annual workplace giving campaign, which we call Grange Enterprise Gives Campaign. And this is where we are partnered with the United Way, to give dollars to the United Way yearly. So because we were all working from home, we had to immediately convert the campaign to 100% virtual. So imagine how in the past years, we have planned all these in-person events to help our associates be engaged, to inform them about the campaign in terms of how they can donate, and taking all of that and making it virtual. I'm happy to say we were able to convert the campaign to a 100% virtual format, and we had a banner year, which I'll talk a little bit more about. But a couple of other ways where we continued this team-oriented approach is through continuing to offer paid volunteer time off for our associates who obviously want to continue to volunteer. And then we also have matching financial gifts through our Grange Insurance Gives Foundation. Also, from a volunteering standpoint, we had to reimagine what that looked like because, as most companies, we are all on a stay-at-home order. So we had to think about how could we provide virtual volunteering opportunities for our associates. Well, needless to say, we figured it out. And a couple examples of how we've done that or how our associates have volunteered virtually is sewing masks for healthcare workers and essential workers, donating school supplies to children, buying lunch for essential workers, donating blood, and then volunteering at the local food banks to pack meals and stock the shelves.
Well, that is wonderful.
Yes.
Wonderful. So in what ways did you communicate with the Grange team to ensure they felt connected and that their efforts were really making a difference in our community?
So one of the great things is we didn't have to really change our messaging and communication approach, as a result of COVID. So, some of the things that we did, which we already were doing, was number one, using our company intranet site to promote volunteer opportunities, and then to share stories around how associates were volunteering in the community virtually. Number two, we have a monthly volunteer newsletter that highlights and continues to highlight various virtual events, also with an extra note in there to our associates to remember that because of stay-at-home orders, the company is not encouraging in-person volunteering, but if they wanted to volunteer on an individual basis on their own, they were free to do so. And then again, one of the biggest ways that we communicated efforts was through our Grange Gives campaign. Again, everything was virtual. We did a lot of great work around highlighting, campaign events and opportunities, for our associates to continue to be engaged, to be entertained, to be informed, and to have fun, because that's all part of like our culture. We like to have fun. We like to get together, but we also like to work to give back to the community. We also did company-wide Zoom meetings where we invited nonprofits in to talk about their specific nonprofit. They shared their mission and they shared different stories around, how they were helping those in need. And then another thing that we did was we invited our associates to share their stories around why they were giving, also to help encourage other associates to consider volunteering or giving to the campaign.
That's great, Priscilla. I might say that, bringing nonprofits in to talk to our staff. That's wonderful. So last May, Grange announced it was contributing an additional $1 million to local nonprofits to support the health and human service response efforts of COVID-19 pandemic. What were some of those nonprofits that you supported and what impact did that make?
Sure. So that's probably been one of the highlights for me as the leader of our community relations efforts, as well as a huge highlight for our company as a whole. Back in May, we pledged that $1 million, and, we were happy to be able to spread the dollars out, to many local nonprofits. So there were several nonprofits that received $100,000 grants from us. Those nonprofits were Community Shelter Board, Life Care Alliance, St. Stephen's Community House, United Way of Central Ohio, and the YWCA of Columbus. And I'll quickly share with you what the impact was with those $100,000 grants. So for the Community Shelter Board, they were able to slow down the spread of the virus among, families and individuals who were experiencing homelessness. And they were also able to think about and put into place a long-term planning project, knowing that the pandemic was going to be around for a while and that there would be future needs for sheltering. So for Life Care Alliance, they were able to continue to live out their mission of delivering healthy and nutritious meals to seniors, as well as those who are medically challenged. And then they also were able to continue some of their other crucial services, which include wellness centers and at-home help for those that need it. For St. Stephen's Community House, they were able to use the dollars with some of their programming to help with emergency crisis support and food insecurity. And then they were also able to purchase PPE equipment for their staff and for the participants. United Way of Central Ohio, they used the dollars for their community response fund. And as you know, they do a great job of making sure those dollars go to the most vulnerable populations. And then finally, YWCA Columbus, they were able to continue to carry out their mission to create safe and supportive and stable, sheltering for women and their families.
That's wonderful. Again, thank you for all you do for the community. Okay, so Grange is dedicated to supporting and promoting diversity within the company and the communities where your team members live and work. Can you talk a little bit about those initiatives and what all you're doing?
Sure. So I'll start with our overall philanthropic strategy, which is very diverse. It has many facets to it. And those facets include everything from financial support, volunteerism, officers serving on our nonprofit boards, in-kind donations, and when we could, we were offering our Grange event space for free to nonprofits to use. So that's I like to share that because that's the diversity of our philanthropy portfolio. But earlier this year, you may be aware that many companies had a call and joined with other companies to declare racism as a public health crisis in the city of Columbus. So Grange added its voice to that. And as a result of that, we gave some additional dollars to the YWCA Columbus, as well as the Columbus Urban League and other organizations who are focused on empowering all disenfranchised groups. A few other things that we did, we recently supported the Deliver Black Dreams campaign, which focuses on, local artists throughout Columbus, where you can go around to different communities and see their art displayed on, various walls. They've done a lot of murals. It's really fascinating. A few other things, we support the African American Leadership Academy, where our COO serves on the board. I'm currently the president of the Central Ohio Diversity Consortium. Through our Pride Associate Resource Group, we support Equitas Health, Stonewall, Kaleidoscope Group. From a senior citizen perspective, we partner with Life Care Alliance. From a young people, kind of Gen Y, Gen Z perspective, we support the Center for Healthy Families. From a refugee and immigrant perspective, we support the Ethiopian to Wahedo Social Services, where one of our associates serves on that board. And then from a low income family perspective, we support Catholic Social Services. So I wanted to share how we look at the diversity piece beyond just race and gender. And then finally, we've been very, very supportive, well over 10 years, for the United Way of Central Ohio's Project Diversity and Pride Leadership Program. And that's where professionals of color and LGBTQ professionals go through a leadership program to learn how to serve on a nonprofit board. We give dollars to that program. We've supported some of the projects. We host the annual graduation, and our CEO has been a keynote speaker at their graduation.
So it sounded like you just named 50 of our wonderful nonprofits around the city. So I love it. I love all these. So with that, coming into our new 2021, yay.
Yes.
So what's on the horizon for Grange in the philanthropy world for 2021?
So as an insurance company with very deep roots in Columbus, and knowing that we have such a strong commitment to give back and that volunteering is just part of our cultural DNA, it's just who we are, that's not going to change. We know that our community needs us now, more than ever because of all of the, negative impacts of COVID, whether it's for food, shelter, education, homelessness, et cetera. So we will continue with our multifaceted approach around giving dollars, volunteering, making sure we have folks on nonprofit boards, our in-kind donations. But I will say, as the COVID-19 crisis evolves, we will continue to align our philanthropic resources based on emerging needs, because we all, we don't know what else is going to arise, right, as a result of the pandemic. But we will continue to prioritize health and human services for those that have been most impacted by the virus.
Great. I know you will.
Yes.
Thank you, Priscilla. I really appreciate this time today, and congratulations again to you and all the associates over at Grange.
Well, thank you so much to everyone who coordinated the efforts for the Medical Mutual Pillar Award. We're again just so pleased that we've been given an opportunity to tell our story around our community relations efforts, and in addition to telling the story, being highlighted and recognized for all of the great work that Grange and Integrity Associates have put forth to get us here today. So thank you very much, Amber.
Yeah, congratulations again.
Thank you.
Thank you, Priscilla. And congratulations again. Now, let's watch our first video of the program about this year's honorees in their own words.
And I got to where I am because the women who came before me, especially Black women, who fought for equity and opportunities. So it is my turn to pay it forward and do everything I can to ensure the next generation of women does not have to fight tooth and nail to be treated, paid, and advanced equitably.
My passion comes from the fact that I grew up in the YMCA, and I believe in Central Ohio and our community and our neighbors. And I believe that our role as a YMCA is to lock arms with our neighbors and serve.
We have a dual mission. You know, we're focused on helping entrepreneurs be successful while helping grow our local economy. And we couldn't do the things we do if we didn't have corporates that gave to us. If we didn't have corporate philanthropy supporting our efforts, we wouldn't be able to do what we do.
So I think the first part is how you create a culture. It's top down and it comes from the top. And then obviously to filter it through, make it contagious, is make it part of your culture, your code, your behaviors every day, how you measure yourself, because then it sort of takes on a life of its own. And then people start to say, okay, that person's doing it. It's just who we are and what we do.
My passion comes from the fact that I was raised with Christian values. My parents came from humble beginnings, and they decided during a very turbulent time in Selma, Alabama, to migrate to the north and to achieve success for their family. They set the example of giving back and serving in their own community, and that instilled in me a desire to help others and to serve.
We wanted to give back to frontline workers, in the hospitals for what they were doing, during the last several months. And so we developed a program called Healthcare Heroes, and we let our guests, for $5, they could contribute to this fund. And we basically took those monies, as well as, a lot more of our own, to give back, to the Healthcare Heroes group. So we've served about 40,000 meals to healthcare workers over the last 9 months.
The for-profit community has a responsibility. Nonprofit wouldn't exist without the for-profit world, and vice versa. So you have to look at a company. If the company is profitable, you want to reinvest in your company, but you have to reinvest in your community. And not just from a PR feel-good standpoint, look what I do, but you got to get down in the dirt and you got to be active and supply time and effort and resources, even more than money.
At the beginning of this pandemic, we kind of sprang into action and supported those who needed it most. We donated 1 million hand soaps and thousands of hand sanitizers to first responders, healthcare institutions, community action agencies, and our nonprofit partners. And we were able to provide an essential product that we manufacture and create at a very essential time in our community's moment.
Ladies and gentlemen, it's been said that time is the most precious gift a person can give. In every organization, there are executives and employees who donate personal time, treasure, and their professional expertise to help nonprofit organizations and whose missions they believe. Now, it's with this in mind that we recognize the Nonprofit Board Executives of the Year. We have 3 honorees this year, so let's meet them. First, Rick Rickard, President of Rickard Automotive and Vice Chairman of the Board for A Kid Again. Now, Rick got involved with A Kid Again in 2017, and he volunteers about 20 hours each month to a cause that has become near and dear to his heart: children. A Kid Again provides adventures for families with a life-threatening illness. Now, among his impact, Rick led a brand awareness campaign by donating his company's video production and marketing team services for an adventure with the kids and their families to Kings Island. The video captured continues to be used in different ways to promote the nonprofit. And this past year, Rick and his Rickard Automotive team hosted a family-focused drive-through fundraiser in partnership with Pepsi. Families viewed princesses, superheroes, live animals, stilt walkers, and more from their vehicles. And over the past 3 years, the number of families Rick and A Kid Again have impacted has grown from 715 to more than 900. So congratulations, Rick. Next, Congratulations to John Semenik, Managing Director and Head of Shared Services for Chase Bank, for his work on the board of St. Vincent Family Center. John's been on the St. Vincent board for 12 years, and in that time, he served in myriad roles, most recently in 2019 as board chair. Under John's leadership, St. Vincent raised money to fund the overhaul and implementation of IT system and infrastructure, creating a foundation for the first electronic health record system. By 2020, St. Vincent had built a modernized IT system that prepared it for the sudden pandemic. Now today, instead of welcoming families to its facility and visiting homes and schools, St. Vincent conducts sessions with clients on a virtual platform. This transition to telehealth has allowed St. Vincent to meet the growing health needs of the community's most vulnerable residents. Now, as immediate past president, John continues to identify ways to impact St. Vincent. So congratulations, John. Our next honoree is Paul DeForno, Managing Director of Commerce and Content Practice at Deloitte Digital, for his work on the board of Catholic Social Services. Now, when COVID-19 erupted and Governor Mike DeWine stated that important services, such as social services, must continue because so many lives depend on them, Catholic Social Services took the message to heart. With Paul's help, the agency took steps to ensure its 13 programs still reached the 35,000 people across the 23 counties it serves. Paul helped CSS identify a new data management system, build a new remote infrastructure, and migrate everything over without skipping a beat. As a member of the IT committee, Paul helped lead that effort, and as a result, the agency moved quickly to remote work, created a series of workarounds, and was able to continue to serve clients. So congratulations, Paul. Paul, congratulations again on being one of this year's Nonprofit Board Executives of the Year, and I want to thank you for sitting down with us today and talking a little bit about what you've been doing.
Appreciate it, and I'm happy to be here, and more so to give a little bit more light of the great work that Catholic Social Services does for the community.
Excellent. Well, let's dive into that then, Paul. Tell us a little bit about Catholic Social Services. Who do you serve? With what kind of services? And what did you get involved with it? What were the reasons why you got involved?
Sure. So Catholic Social Services of Columbus is a multi-service agency that has been around serving families and seniors in Central and Southern Ohio for 75 years. In fact, this year is the 75th anniversary of providing these services. And CSS helps the working poor families stabilize, become self-sufficient through their case management, training, crisis intervention. And what they do is provide the tools to help them, get better. So it's not just, the services around food and food pantries, but really helping them to make a difference and improve themselves. We also help low-income seniors and different people with challenges to have more independence through supportive services. And overall, Catholic Social Services helps 13 various programs in 23 counties and 5 locations, helping 35,000 people across Ohio.
That's a significant impact.
Yeah.
So I know from your perspective and your expertise over at Deloitte, what drew you to them?
Well, I think first of all, you're always looking for ways that you can give back to the community. And the fact that all of the good that they're actually doing on the front line and helping in different pieces, my background, I'm an immigrant. I came from Canada and my family actually came from Portugal. And so we see the benefit of helping, immigrants as they come. And Catholic Social Services has this great program with the Our Lady of Guadalupe Center, which started out just as a food pantry, but has become a full community center to the Latin community, especially the new community that has come a lot from Central America, that they've had, some of the challenges. And in many ways, through COVID, they're on a much more proportional basis on the front lines. So they're helping all of us from a delivery, all these. So the Latino community is 4 times more at risk with COVID. And so for me, any way that I could give back, that I see the benefits to the immigrant community, that's really why I wanted to get involved.
No, that's great. And Paul, it sounds like they're doing some amazing work there. 2020 though, strange year last year. We learned a lot about technology and how organizations and individuals interact. And in this nonprofit space, it's never been more important. You helped, and you've been working with CSS Pivot and its infrastructure upgrades, which had started pre-COVID, but needed to be accelerated. Can you talk a little bit about what was done and why it was done so fast?
Sure. Well, if you think about nonprofit agencies of this magnitude with these hundreds of people that work there, plus all the different people that they impact, and you have to be remote, you need the technology to be able to facilitate, just like any other organization, right? So, nonprofits need to, do more with less, and technology enables you to do that. And so that's important. But not only that, sometimes you also forget, like when you get into all these programs and all these funding sources through different government agencies, you have to report back. So you need to provide that detail, and the more that's manually done, it'll just be more cumbersome. And so what CSS is really trying to do is be at the cutting edge of, hey, we want to be able to help provide, not only be more efficient and automated so that they can get back that information to all the government agencies, but the thing that's most important that I really, and this is something that the executive director, Rachel Lustig, has really pushed, because, she is a big believer in data, right? And so if you have better data and understand the problems, you can now help people have better outcomes, right? It's one thing just to give people food, but how do you try and find the complex way of how being poor and not having the opportunities affect them? It's a complicated issue. And you really need all those data points to be able to have better outcomes. And so having that context, having what they're really looking at is because they've grown organically, all these different programs, you had 12 or 13 maybe different systems that were supporting it, and very cumbersome to share data across. And so we decided to accelerate the push to get into a newer system and do a system selection and get onto a platform that could future-proof, could really drive so that they could get these outcomes and be able to make better decisions and get better, better use of money and better outcomes for, the people on the front lines.
So tell me a little bit about where they are in that process. I know that you were able to get things up and running pretty quickly, at least part of it, so that people could communicate and do some remote visits. Where are you at in that continuum in terms of completion?
Sure. So I think I'm I'm part of the IT committee as part of the board, and some of the initial things that they have a great IT leader there at CSS, Dave Panic, who, like, soon as imagine from one day to the next, you instantly have to go all remote, where everybody, so there's a lot of very tactical, how do you buy laptops and get those all deployed? So that was very tactical, but, insane amount of work had to go in, and, we, pushed, and they had to do what they needed to do. But on the other side, which is because this remote and having these new systems is needed, we really pushed to say, hey, this is the time to now accelerate to get onto a centralized system that you can all go and build going forward. And so where we got to, they picked the new system, we did the design, it's in the midst of being developed and rolled out. And the goal is by the end of 2021 or the beginning of 2022, it will have rolled out across all of the different programs and locations.
That's great. Well, Paul, it sounds like there's a lot going on there, and appreciate the input that you're giving from your perspective, as well as your time spent on the board over there. So we want to thank you again for everything you're doing in this community, and want to say congratulations again for being recognized this year. So congratulations.
No, I appreciate it, and really, what I'd love to do is again give the people that are out on the front lines doing the hard work, right? That they it's such a worthy cause. And the stuff that they do for the working poor in Central Ohio and the seniors is so important. That's really what is the important piece.
Excellent. Well, thank you again.
Great.
Thanks for being here today.
Okay, thank you.
Congratulations to our 3 nonprofit board executives of the year, John, Paul, and Rick. So ladies and gentlemen, we're now going to send the program back to your tables, where we'd like you to spend the next few minutes networking and, if you'd like, to share how your company has approached community giving during this past year. Also, if you happen to be a nonprofit leader or team member, what did you and your organization do to fundraise during these challenging times? Or how did you connect with your constituency to ensure you were able to serve them? And finally, for everyone, what did you learn about your company during the COVID crisis as it relates to community service? So we'll see you back here in a little while for the next part of today's program. Welcome back, everyone. We hope you had a great conversation. Our next category as we move forward is the Pillar Award, which recognizes for-profit companies that employ corporate giving through donations, pro bono work, volunteerism efforts, and team members who serve on the boards of nonprofits. Now, this is the core award around which the Pillar Award for Community Service Program was built. To help present this category, please welcome my colleague from Smart Business, Janet Valori. Janet?
Thank you, Dustin. What an honor it is to be a part of such a meaningful event. The Pillar Award for Community Service is near and dear to my heart and has been since the inception many years ago. So let's meet the first 5 of our 10 Pillar Award honorees. The first honoree is Air Force One. Let me tell you a little bit about them. A challenging 2020 did not dent Air Force One CEO Greg Guy's commitment to positively impacting the community. During the pandemic, he found ways to provide community and client support outside the organization, as well as support team members. For example, Greg created the AFO Associate Relief Fund to help employees by making funds available to those who experienced financial hardship. Grants were approved to pay for necessary personal and living expenses incurred due to COVID-19. Beyond this, he continued the Air Force One service to other philanthropic programs, which support external volunteer and philanthropic efforts. The program allows employees to take up to 3 paid days off per year to support nonprofit community service work. Employees have logged thousands of hours through this program. Even during the pandemic, they were urged to serve organizations that need help. Congratulations, Air Force One. Our next honoree is Penzone Salons and Spas. For more than half a century, team members at Penzone Salons and Spas have offered their time, talented hands, and caring hearts to a multitude of philanthropic organizations in Central Ohio. During the unprecedented COVID-19 pandemic, under the leadership of Debbie Penzone, the team recognized the need to support the community was greater now than ever. So Debbie and team members got creative with their usual philanthropic efforts through 2020 to uphold the company's commitment to paying it forward. Although Penzone Salons and Spas, supports many organizations throughout Central Ohio, it is a strong advocate for causes that empower and support women and children. Annually, it supports the American Heart Association Go Red for Women Luncheon, which Debbie was the first chair. In addition to cash sponsorship, the company provides a booth that offers a styling salon and lip bar. Congratulations, Penzone Salons and Spas. Our next honoree is City Barbecue. Listen to this. Rather than give up on its community service efforts in the face of the global pandemic, City Barbecue, led by founder and CEO Rick Mailer, developed new and innovative ways to give back. In the early days of the crisis, it wanted to show gratitude for the doctors, the nurses, the medical personnel, and the hospital staff for putting themselves in the front line to save our lives. To thank them, City Barbecue implemented Healthcare Heroes. For $5, guests could help provide a sandwich and 2 sides to a medical worker, to the whole unit, or to the shift with catering teams by bringing barbecue into the hospitals. The company has also resumed its fundraiser program, which it paused in the beginning of the pandemic. City Barbecue restaurant teams have thrown themselves back into the swing of things with their fundraisers, in which 20% of the revenue is given to a community partner. And its employee assistance fund, City Cares, has helped team members with unforeseen hardships. Congratulations, City Barbecue. Our next honoree is Columbus Crew SC. As if winning the 2020 MLS Championship wasn't enough, Haslam Sports Group founders and team owners Dee and Jimmy Haslam pledged $1.5 million to COVID-19 relief funds throughout the state of Ohio. Through their Haslam 3 Foundation, the Haslams earmarked $500,000 to the Columbus Foundation Emergency Respond Fund. KIPP Columbus, part of a national network of free open enrollment national college preparatory public schools and a longstanding partner of Columbus Crew, was one of many aid recipients. In the team's foundation, partnered with U.S. Soccer Foundation, Musco Lighting, and Columbus Rec and Parks to install 2 new mini pitches in the Columbus community, and led by the team president and general manager, Tim Bezbachenko, the crew engaged in numerous community events, including hosting the NC4K Back to School Bash, which provided school supplies and backpacks to pediatric cancer families via drive-through events. Congratulations to the Columbus Crew. Our next honoree is Goldfish Swim School, Dublin Westerville Lewis Center. Goldfish strives to reach as many families as possible to spread water safety awareness. That's because, on average, every day 3 children drown in the United States. Lisa Armitage and her husband Steve own and operate 3 Central Ohio locations of Goldfish Swim School. Their community outreach programs have reached thousands of children and families in their facilities, and thousands more throughout the community outreach programs. During COVID-19 shutdown, the Goldfish team has been providing free online resources, including water safety, educational activity sheets, a video series teaching children safety, swimming tips, and age-appropriate workouts, virtual water safety information. Goldfish Swim School provides free 30-minute water safety programs to area preschools, elementary schools, parent groups, scout troops, and other community-based organizations, and has visited over 36,000 students in Central Ohio. In addition, it has expanded its water safety program to help children with disabilities, hosting swim camps in conjunction with the Down Syndrome Association of Central Ohio. Congratulations. Our next honoree is L Brands. Throughout volunteerism leadership, product donations, and direct financial support, L Brands has advanced the mission of hundreds of organizations in Central Ohio. Getting involved makes a difference, and the company's associates roll up their sleeves to help. In 2019, associates donated more than 10,000 hours. The company makes it easy to get involved through its partnership with BESA, which connects associates to group volunteer opportunities that are in alignment with the L Brands philanthropic focus areas. The company also has more than 100 business leaders who serve on nonprofit boards throughout its Community Connections program. And this past year, L Brands product donations include hand soap, sanitizers, to first responders, healthcare institutions, and other community partners. Since March of 2020, L Brands has also made significant donations to the American Red Cross and Feeding America to aid in pandemic relief. Congratulations, L Brands.
Congratulations to the first 6 members of this year's 11 Pillar Award honorees. Next up is the 2021 Philanthropist of the Year. And this year's honoree, Dr. Joshua Joseph, is an assistant professor of endocrinology, diabetes, and metabolism at The Ohio State University College of Medicine. Dr. Joseph refuses to take sole credit for the impact he's made in exercising his passion for research and population health. Yet wherever work to eliminate health disparities related to race and discrimination occurs, he seems to be there. So Dr. Joseph's work is best characterized as hands-on, partnership-based volunteerism. As an investigator at OSU's Diabetes and Metabolism Research Center, he combines his academic work on type 2 diabetes and cardiovascular disease with his hundreds of hours of public and private collaborations. His focus has been on the chronic health issues that disproportionately plague people of color, and one of the first organizations he engaged with was the African American Male Wellness Agency. With funding from OSU Connect and Collaborate grant, the team, including the African American Male Wellness Agency, developed a project called Black Impact 100, which worked with 100 Black men to improve their cardiovascular risk factors. Dr. Joseph is also working with the OSU Center for Clinical and Translational Sciences on the Community Services Academy, where people learn more about research and they sign up to advocate in their communities for minority population participation in research, so that medications that are developed work for everyone, not just majority populations. That's especially critical during this COVID crisis and the recent introduction of new vaccines to Americans, as it has helped level the playing field. Now, finally, as racism and discrimination are now widely considered social determinants of health, Dr. Joseph is committed to effectively addressing racism and discrimination in healthcare and medical education. So, it is with this in mind that Joshua and his team are currently building out an innovative program to more effectively connect individuals to resources that address social determinants and improve overall health. So on behalf of Smart Business, Medical Mutual, and our sponsors, for all of this work and more, I'm honored to present this year's Philanthropist of the Year Award to Dr. Joshua Joseph. So let's learn a little bit more directly from him. Joshua, congratulations. Thanks for joining me today.
Well, thank you so much for having me, and thank you so much for, I'm humbled by this award on behalf of myself and our entire team here at the Ohio State University Wexner Medical Center and all of our community partners, including the African American Male Wellness Agency and the American Heart Association.
Well, Joshua, let me ask you a question. How did you identify the type of work you're involved with, and how is it helping impact change? It is absolutely fascinating having read your background.
Yeah, so, Dustin, I've always been interested in diabetes and heart disease. And many people ask me, well, why is that? And for me, it was personal. I had a grandmother who had diabetes. She's the person who taught me my ABCs and my 1, 2, 3s. And unfortunately, when she came to stay with us, she had diabetes. So I saw her give herself injections of insulin. And I also remember the first time she went to the hospital clutching her chest, right? And in that moment, I was a young boy, trying to understand, what does that mean? And fortunately, that first time she went to the hospital, she came back home and we continued the lessons, and a large part of why I'm here today, right? But there was a time just a few months later where she clutched her chest, went to the hospital, and never came home. And as a young boy, for me, that was truly impactful in my life, about what are the things that we need to change so other little boys can have their grandmothers, grandfathers, aunts, uncles for longer periods of time. And so when I went to medical school, that work really came full circle because there we did a program as part of the Student National Medical Association where we went out in the community and Medicare had a program, the state of Massachusetts had a program where individuals could get free care, but people didn't know how to access that program. And so when I went out in the communities, what we saw was that it was individuals that looked like me. that were most in need of care, struggling with diabetes and hypertension. And so when I saw that, I thought, not only do I want to impact individuals, but we want to have a larger impact. We want to impact communities and towns and the country so that everyone can lead longer, healthier lives.
That makes a lot of sense. And it clearly, is something that is happening today, right now. I mean, as we speak. So, one of the things that interested me about reading what you've been able to do there is the underlying reasons of why chronic health issues are disproportionately impacting people of color. Why have you seen that happen? What are the reasons for that? And what are some of the avenues for potential solutions moving forward?
Yeah, that's a fantastic question. And, for a long time, we've given many reasons why underrepresented groups, minority groups, underinvested communities, et cetera, have higher rates of diabetes, hypertension, obesity. And what is more and more increasingly recognized is that these factors that really drive that are the social determinants of health, right? And these, are think about, where we live, work, play, and pray, right? So where do we spend our time? Right. And so when we think about these social determinants of health, we know that they drive about 80 to 90% of all health. I hate to say it, but what I do in the clinic, right, and genes, that's only really about 10 to 20% of someone's health. It's these other factors that really drive health. And so I think of them in this way. I think of them as a river. Dustin, you've probably seen, many rivers out there, right? You have an upstream part, a midstream part, and a downstream part, right? So upstream, when we think upstream, we're thinking about those real causal factors, things like poverty, discrimination, racism, and then how those things impact what I call the midstream determinants. Things like we see on the front page of the Dispatch every day: food insecurity, poor nutrition, people living in unsafe or overcrowded housing, environmental exposures to toxins. We're having a large conversation right now about income inequality and the impacts of that. These are these social determinants that really have a huge impact on someone's ability to achieve great health. So what do those things lead to? Well, they lead to downstream health outcomes: diabetes, obesity, hypertension, heart disease. Many of the same things that we not only see in the communities, but I've seen in my own family and the families of many of my friends and colleagues. And so the question is, well, how do these things actually impact health? And they do that through stress, right? There are many stress pathways in the body. We work on one called the cortisol pathway, which is our response to stress within the body. And these pathways actually modify a number of things, but they can actually change the function of genes, what we call the epigenetics. And so we have to really address these social determinants of health if we're going to make any progress in our disparities that we see in a number of chronic conditions.
Joshua, thank you for sharing that. I mean, that's very enlightening and insightful. Talk a little bit about this Black Impact 100 project that I read about that you're involved with. What's it designed to do, and how do you see that this is going to help move the ball forward?
Yeah, so thank you so much for asking about Black Impact 100. And so what I should say there, just to start, is that, this is really an endeavor and a journey that we've been on with many groups, right? And so we have many partners, myself, Dr. Daryl Gray, Dr. Tamaya Nolan are the faculty leads here at Ohio State. But in many ways, we are the least important part of this project. The most important part of the project is the community partners. So our partnership with the African American Male Wellness Agency, the American Heart Association, the Franklin County Public Health, Columbus Public Health, all coming together with the most pivotal piece, Dustin, and that is community members and community stakeholders. So what happened? So these men, we were working with the African American Male Wellness Agency, going out to the annual walk. And we have, between 30 and 50,000 people out in Central Ohio every year for the walk. People knew it was important to know their numbers, right? What is your blood pressure? What is your cholesterol? What is your blood glucose? But the big question, Dustin, was, are those numbers changing? Are we making an impact on people year over year? We had stories where men were coming out and we'd have to send them right to urgent care, right to the emergency department. And so, yes, there was an impact in that moment for that person. But over time, were we having a longitudinal impact in the lives of these individuals? And so what we saw when we looked at the data was that a lot of the data wasn't changing. And so we wanted to develop a program with the community to improve these numbers. And we really focused on 7 factors: blood sugar, blood cholesterol, blood glucose, BMI or weight, physical activity, diet, and smoking, what we call Life Simple 7. And so with the men, with the community stakeholders, we designed a 24-week program where men met once a week with a personal trainer to do physical activity, about 45 minutes, and then 30 minutes of education on important health components, ranging from blood pressure to diabetes, following some of the already proven programs in other populations, including the diabetes prevention program. We also linked them with primary care providers so that they could get the care that they needed, as well as we talked with them about the social determinants of health. Not only did we talk to them, we worked with local agencies here in Columbus, including the the Health Collaborative of Greater Columbus. And with the Health Collaborative, we were able to link them with community health workers who could actually address these issues. So if someone needed food, we were able to get them food. If someone needed housing, we were able to work on housing for them, right? If someone needed transportation or employment, we were able to work through these issues to really not only address those downstream components I talked about earlier, right? So not only addressing, blood pressure and cholesterol, but going upstream and thinking about those social determinants and having an impact there as well. The last thing I'll say is that one of the most important components of that whole project has been trust. It took a lot for Dr. Gray, Dr. Nolan, myself to go out in the community and build trust, right? You can't just show up in a community and say that you want to work with individuals on their health, right? That's a recipe for disaster. You have to be in the community, a part of the community to do that work. And so we spend a lot of time building trust with the community. And I think that what you will see over the coming months is that has paid great dividends and that we have built a true brotherhood in this program, which will be critical to improving Black men's health long-term.
Excellent. Well, Joshua, thank you for sharing that and congratulations again. Thank you.
Thank you so much, and just honored, truly honored on behalf of all of my colleagues and my family, which without my family, none of this would be possible for this award.
Thank you. Once again, congratulations, Dr. Joshua Joseph. Now, let's take a moment to watch the second video and hear from our pillar honorees in their own words.
Our Lady of Guadalupe Center is a center that's targeted towards the Latin American community of immigrants that are people that have come to this country because of war-torn parts of Latin America. They're some of the hardest workers. They just need an opportunity. And so that's something that I'd love to give back to, especially to that community.
Hunger is one of those things that are often hidden in this great nation, in this great state. How we can allow people who work hard, who end up standing in food pantry and soup kitchen lines at the end of a long work day because they don't earn enough. Hunger is solvable. What it takes is will. It takes the commitment of individuals who are willing to give their time, their talent, and their treasure, but we need sound and effective public policy. No one in America should go hungry.
Giving back to the community helps build trust in our brand, obviously, but it also shows how, devoted we are, to our mission of keeping kids safe in and around the water. The best way to spread awareness, is to be out in the community, building relationships with families and other businesses.
So we work with the Ohio Prisoners Entrepreneurship Program at the Women's Reformatory in Marysville. They have a fantastic entrepreneurship program there. The women there are stellar. So it's not a situation where we're giving money, but we're giving our time and service.
The positive impact is the ability to take a child that is dealing with emotional and behavioral problems and help them understand what they're going through, and provide them the tools that they need in order to deal with those issues. It is great work that they do to help the children, and not just the children, but it's also helping the whole family deal with the issues that the child is experiencing.
As an insurance company with deep roots in Columbus, our company has always had a strong commitment of giving back. We continually seek ways to create opportunities in areas we serve because we believe that beyond providing peace of mind and protection during life's unexpected events, we can help build healthy and vibrant communities.
When I think about our Service to Others program and the 3 STO days that we provide to our associates, what I ask them to do is to bring that spirit of charity back into the organization, right? So they spend their day out in the community doing community service and bring that back to our culture at Air Force One.
Dress for Success, they do a New Year, New You. And so we've donated, of course, what we do is, makeovers and really help these women that are challenged to go out and interview and conquer that job interview to get back to the workforce. And so we've helped with, makeovers within the salon for hair and makeup, and really helping build that confidence in the women to not only just put on the dress attire from Dress for Success, but to really look the part and feel confident.
Welcome back. Our next award is the Kent Clapp CEO Leadership Award. To tell you more about Kent Clapp and this award, as well as to present it, please welcome Medical Mutual's President, Chairman, and CEO, Rick Chiricosta. Rick?
On behalf of Medical Mutual, it's our pleasure to be part of this annual program. This award is named in honor of Kent Clapp, my good friend and predecessor as CEO of Medical Mutual. Kent was actually instrumental in the creation of the Pillar Awards back in 1998. And tragically, he lost his life way too soon. But in memory of Kent, every year, one top executive of a for-profit organization is recognized for his or her individual passion for philanthropy, much like Kent had, and his or her ability to drive that passion throughout an organization the same way that Kent did for many years at Medical Mutual. This year's honoree is doing tremendous work in this region. So let me tell you a little bit about Dr. Stephen Markovich, President and CEO of Ohio Health, this year's Kent Clapp CEO Leadership Award honoree. In early March, Ohio Health Associates received a message from Dr. Markovich informing them of the severity of COVID-19 and what it not only meant for the healthcare system, but what it meant for the entire community. Simply put, the system found itself on the front lines of the pandemic. While working to reduce the spread and protect its patients, associates, physicians, and volunteers, Ohio Health's priority always remained the safety of Ohio Health Associates and the community. Dr. Markovich's message and actions have remained consistent in trying times. Dealing with COVID-19 is a marathon, not a sprint. Under Steve's leadership, Ohio Health partnered with 3 other central Ohio healthcare systems to collect personal protective equipment and medical supplies for the benefit of all central Ohioans. Ohio Health opened a supply donation warehouse specifically for PPE donations, provided oversight to coordinate donation deliveries and pickups, and added locations. To encourage donations, Karen Morrison, president of the Ohio Health Foundation, corresponded with Ohio Health's community partners to encourage large organizations in Central Ohio to participate. Through this collaborative effort, the organization collected over 1.1 million donated items of critically needed PPE, such as face masks, gloves, hand sanitizer, and more. And nearly 90% of the donated items were able to be used to help protect frontline healthcare workers. In June, Ohio Health reached out to community partners to provide them with supplies donated to the area hospitals in the early stages of the pandemic, but that it was unable to use for their system. And this is just one of the numerous initiatives that Dr. Markovich and his team either spearheaded or supported this year. Well deserving of this award. Congratulations to Dr. Stephen Markovich, this year's winner of the Kent Clapp CEO Leadership Award. Well, let's learn more from Dr. Markovich. Thanks for joining us, Steve, and congratulations on your award.
A pleasure to be here. Thank you very much. It's a wonderful award. Big thanks to Medical Mutual and Smart Business on behalf of the 35,000 associates, physicians, and volunteers at Ohio Health. Thank you very much.
Great. Dr. Markovich, on behalf of Ohio Health, you forged a partnership with 3 central Ohio-based health systems to collect personal protective equipment to help protect healthcare workers, eventually collecting more than 1.1 million items. Karen Morrison was tasked with the project and connecting with the community for donations. Can you talk a little bit about the initial process, how it came about, at what point in time you began assembling your team, what was the response from your team, and how long it took to get everything off the ground? That's a lot of questions, but what are your thoughts?
Sure. Well, back in March of 2020, I think most people were aware there was a national shortage of personal protective equipment, and especially at the hospital level. And we started to receive communication from industry, the community largely, where folks were offering things up. We put together a team of supply chain, coordination, logistics, transportation to start to respond to some of those offerings that were coming in. We got a warehouse, we put together a distribution tracking system, and then it seemed to me that this was a time when the 4 major health systems in Columbus, we needed to collaborate, that this pandemic was going to be bigger than all four systems would ever be. And it was really time, as I said on a phone call one day, I said, we got to check our egos at the doors and let's do this together. So how do we, rather than competing for things, why don't we come together? Why don't we try to centralize this as much as possible? That then spread to our regional sites. And in the end, we did, as you said, we collected more than 1.1 million items that the vast majority of which we were able to put to use within the walls of our institutions to help. And that happened over the course of a couple of weeks that really everything was lined up. So it was a great outpouring of support from the community, but I'm just super glad we were able to coordinate it so that we were able to make sure nothing went to waste and we were able to use those things to take care of our people.
That's very inspirational, Steve. And how important was it for Ohio Health to take a leading role in this project? And maybe more interestingly, how did your team develop a supply chain for distribution?
Well, we've got a great supply chain to begin with, and I'm very proud of them. But once they were able to catalog everything, to track it, assess the status at each of our care sites, what they had, what they needed, we even put in place using our patient and staff transport vehicles. We were pushing equipment around the system and pushing supplies around the system. It happened very rapidly. We had great communication. We established an incident command center that was really the focal point. And one of the things I did from the beginning was to say, listen, the senior executives at the Ohio Health Core headquarters, we're not close enough to the action to manage this. We're going to have to get people from the front lines to be involved in really running the day-to-day operations. So we put a great deal of trust in those folks. We created a communication system so that the senior leaders, we knew what was happening. We could break down barriers and authorize whatever they needed to get the mission done. But really, this was done by the front line and that next layer of supervision. I couldn't be prouder of the organization.
I can see why. Steve, we all know that COVID has put a major strain on healthcare systems, not just statewide here in Ohio, but nationwide. How have you, as the leader, communicated with your team from management all the way down to frontline workers about the importance of all this work that you guys are doing and all your partners and the best way to remain safe while doing it?
Well, although we pushed a lot of the decision-making down to the lowest level of the organization, I thought it was really important to have the CEO, to have the senior leader be as transparent and as available as possible to give people confidence in what was happening. So we set up a process where every Tuesday I would do a video. There would be these videos from Steve that would go out to every associate at Ohio Health. And we would do 3 minutes on 3 topics. and try to make sure that they understood what was current, what the issues that we were dealing with were, and where we were in the process. So it was all about transparency. If we made a mistake or if the situation or the posture needed to change, I came back the next week and I said, new information. So it was very transparent and very open, and it's worked very well, and we're continuing it right now.
Great. Frontline workers, since you mentioned them as well, we know they're facing mental health and exhaustion issues every day. Now, how have you developed support systems for your team members, and what have you done for yourself?
Well, those are two really big questions. Ever since I took the job about a little over a year ago, I have always said, and it comes from my military background, the mission comes first, and you can't accomplish the mission without the people. So I made a commitment right up front, even talking about it in those videos, that we were committed to our people's financial stability, their economic stability, and their health stability. So things like PPE, we needed to make sure we got there as much PPE pushed out as possible to keep them healthy. We were fortunate that because of a legacy of stewardship at Ohio Health, we didn't have to lay anybody off, so we were able to protect them financially. But then you got into this idea of their emotional well-being. We created resilience teams. We actually have a physician-led resilience department, and they created dashboards, and we were able to give people resources, whether it was through our associate assistance program. We created a fund to help people that had unexpected economic disturbances in their personal life that they could tap into. We made sure that people had time off as much as we could so that they could recharge their batteries. So we took it very seriously, and we still talk about it every Wednesday. We've got a resilience conversation and a resilience dashboard that we go over. Personally, it's been a challenge. You end up working from home. You try to manage your personal health. You get as much sleep as you can. Get some exercise when you can. Watch the diet. I will admit that I did succumb to the not COVID-19, but COVID-20. That 20 pounds that I picked up working at home. But I'm working that off now. I'm back at some of the gyms have opened up, so I'm back at it. But I think that's the best thing we can do. I get my batteries recharged when I go out to the care sites and visit with the people on the front lines, put a mask on and put some gowns on and go out and visit with people that are providing care. That's what it's really all about.
That's awesome. Well, finally, Steve, how has the crisis overall impacted Ohio Health? And looking forward, how do you think this might change the way that the healthcare system operates in the future?
Well, there's no blueprint for a pandemic. I mean, as you said, we haven't talked about anything like this, I think, since 1918. And I had been in the job less than a year when the pandemic hit. So it was a challenge, and it was something we had to experience together and work our way through it. I think it forced us to make decisions. As I said earlier, we pushed decision-making down lower in the organization. We worked really hard to keep our values and our patients at the center of every decision we had to make. So when I gave guidance to those teams that were making rapid fire decisions, I said, do the right thing, put the patient at the center, keep the values forefront. Things like telemedicine, I mean, the way we deliver care, our whole care delivery model has needed to evolve. If you look at how we provide care, it's really changed. We went from a handful of telemedicine visits to hundreds of thousands of telemedicine visits, literally overnight. How we use emergency visits. Does everyone need to come to the hospital? How long do you stay in the hospital? And things like that. We've really changed things. We partnered in the community in different ways that we've not done before. Recognizing that this pandemic was new to everyone. We had partners like the Y and the United Way, because we have masks. We have things that are used in protecting ourselves. But you think about the general community when those things weren't available at the beginning. People and kids, they needed guidance, and they needed equipment to help them if they needed to go to the grocery store, if they needed to go to get something that was essential. The government's saying you need to wear a mask, and they're saying, where do I get a mask? Because they've all been consumed. So we tried to make sure that we were supporting the community. We weren't able to use all of that 1.1 million items that were They all weren't hospital grade, and we pushed any overstock we had right back out to the community. So it was things like that changed in our relationships, not only within the walls of our institutions, but how we relate to the community that we live in.
You're a great leader, Steve. And I got to tell you, I'm really proud that you're the winner of the award named after my good friend Kent Clapp. So congratulations again.
Well, thank you. It's humbling. We've had a great relationship over the years, and on behalf of the entire organization, I'm proud to accept it.
Thank you.
Well, congratulations to our Kent Clapp CEO Award honoree. Now, ladies and gentlemen, since we're here to demonstrate the tie between the for-profit and nonprofit worlds, it only makes sense to recognize the hardworking and innovative individuals who run the nonprofits and employ savvy business practices that lead to success. These are our 2021 Executive Directors of the Year. We've got 3 this year, so let's meet them. First, Tony Collins, CEO of YMCA of Central Ohio. Now, Tony and his team nurture the potential of children, they promote healthy living, and they foster a sense of social responsibility. The YMCA is a critical partner of Community Shelter Board in meeting the needs of people facing homelessness in Columbus and Franklin County. It operates shelter programs for single women, single men, and families, and delivers rapid rehousing programs for single adults. The YMCA also operates permanent supportive housing apartments with healthcare, employment, and other support mechanisms for people who have a disability and who have experienced long-term or repeated homelessness. During this current pandemic, Tony and his team brought 3 new facilities online to assure social distancing in shelters, which was a Herculean effort that was critical to keeping COVID-19's virus from spreading like wildfire throughout homeless shelters. This effort also included adding more beds in these new facilities to ensure that anyone who needed shelter had immediate access. Congratulations, Tony. Next, Barbara Smoot, President and CEO of Women for Economic and Leadership Development, or WELD. Barbara is an advocate for the advancement of women and women of color. She and WELD have created a series of programs designed to increase the gender and ethnic diversity on for-profit boards, government boards, and commissions. Last year, for example, Barbara and her team launched national forums on Black women's Equal Pay Day and Latina Equal Pay Day, both designed to shine a spotlight on the issues and spur action. WELD's grown significantly under Barbara's leadership, from a local organization with 170 members to a national chapter-based award-winning 501c3 organization with more than 1,000 members. Today, WELD has more than 5,000 individuals that attend its programs each year, and the national headquarters sends more than 60 women on scholarship to the National Leadership Conference. In all, Barbara's efforts are making an impact in every area that she and WELD touch. Congratulations, Barbara. Next, congratulations to Lisa Hamler-Fugit, Executive Director of the Ohio Associations of Food Banks. Lisa is one of the state's most passionate advocates for its most vulnerable citizens. Her organization is Ohio's largest charitable response to hunger and represents the state's 12 Feeding America food banks and 3,500 member charities, which include food pantries, soup kitchens, and shelters. In fiscal year 2020, the associations and its member food banks acquired and distributed 270 million pounds of food and grocery items, or about 225 million meals for Ohio families. When the pandemic hit, the state's food bank's volunteer base was drastically reduced as older workers had to shelter at home. In addition, many had to fully restructure their operations to provide safe drive-through distribution centers to maintain social distancing. At the same time, the demand for emergency food skyrocketed as families had nowhere else to turn, and many found themselves unemployed for the first time. Lisa and her team jumped into action. They worked with food bank members to pivot operations and to support those efforts. Simultaneously, she worked with Governor Mike DeWine to request support from the Ohio National Guard, which has been a critical lifeline, allowing food banks to keep their doors open. So congratulations, Lisa. Well, Lisa, congratulations again, and thank you for joining us today.
And thank you. It's quite an honor. And I also want to congratulate my fellow Pillar Award nominees and honorees as well for their commitment and their dedication to their causes in support of our community. So thank you very much.
Thank you. And I'm sure they appreciate it. It's been a rough year and so many people doing amazing things right now. And one of those is what you've done, with the group that you represent. Let's talk a little bit about that. How have Ohio's food banks risen to the challenge created by the COVID crisis this past year?
Well, as essential workers and on the front line, we were impacted immediately. The first thing that happened to our network is we operate large food depositories, and we rely on a network of 3,500 member charities, food pantries, soup kitchens, and homeless shelters. And those 80% of those member charities are faith-based organizations operated by volunteers, generally senior citizens, the very individuals that were most at risk as a result of COVID. So our agency network closed down. So it required us to retool immediately into a no-touch direct model from what we call truck to trunk in mass distributions and going into communities where we had relied on our member charity network to start to do the direct distribution, honoring social distancing as well, to get food to more people than we've ever fed before in our history. Some of our food banks have been operating for more than 40 years, and 2020 broke all-time records. So again, more food to more people who, for the first time, many who reported that they were our donors last year were now standing in our food lines.
Yeah, I've seen the lines on TV. I'm president of a nonprofit in Northeast Ohio, which we operate one of those pantries as well. So I've seen it. It's heartbreaking, truly. But let me ask you this, what actions were you and the association able to take to work with the state's various food banks to make those things happen? Because there was a lot of need and a lot of things happened very quickly.
We did. The first thing that we needed to do was to ensure that we were identified as essential support systems. So we were part of the governor's first executive order identifying that the essential role that we played to make sure that our staff could get to the food banks. We were able to get additional resources in the way of trucks and food dispatched, ordering food in bulk, trying to secure as much food as we possibly could, and then to get the support systems to our member charities, such as the food pantries that were going to be open, and to make sure that they could operate safely, getting them not only the food and the resources that they needed, but also the PPE, the face masks, the gloves, the hand sanitizers, and moving from what had been a shop through model to getting them supplies such as boxes to be able to do pre-made boxes. The big one was the mobilization of the National Guard. We knew that we needed more boots on the ground than ever before. And part of that March order of the governor was the mobilization of more than 500 National Guard soldiers that came into our communities, not only with their brawn, but also with their equipment as well, bringing in additional trucks to help us set up alternative distribution models. So more resources, both food funding and other manpower to help us operate.
The governor's office was, extremely active in the early days of this, working with people. And there were so many priorities that they were trying to tackle all at the same time. How did you approach the governor's office to help, and how were you able to make sure this became a priority as well?
Great question. One of the things that, and I want to give credit to the governor and to his cabinet, I think identifying what those essential services were and a prioritization that as Maslow's hierarchy of need, I believe that the governor recognized that it was really about the basic needs, as we saw literally thousands, tens of thousands, and then hundreds of thousands of Ohioans losing their jobs. And they didn't have a safety net to fall back on, is that he identified both hunger, housing, and then community support through our community action agencies, and then mobilized what he called the philanthropy task force, where we had business leaders, we had state agencies, we had foundations and corporate grant makers that all came together. So it was, we were having weekly and sometimes multiple calls during the week to identify where those hotspots were. And the governor then started to mobilize his resources through things like not only the National Guard, but through executive orders that provided us with additional funding, working with the Federal Emergency Management through FEMA to get us additional resources. And then, as I said, the state's resources. PPE was so difficult to come by in the early days. How many of us had face masks laying around, right? Let alone the hand sanitizer and the gloves. So again, mobilizing the resources of the state in the prioritization. I think we all knew that the least among us were the ones who were really suffering the brunt, first and foremost, of a massive public health crisis that then became an economic crisis that resulted in massive hunger and food insecurity.
Yeah, and Lisa, it seems, one of the things I've seen more generally speaking is that the need for food banks, even prior to this current crisis, has been on the rise for several years. And what I'm interested in just briefly is what do you think has been causing that increase? And, from your position at the association, what have you been doing to kind of work with the food banks around the state to make sure that those needs are met?
Advocating sound and effective public policy. Most of the people that were standing in our food line prior to the pandemic were folks that worked and played by the rules every day, but they were stringing together multiple low-wage, part-time, temporary, contingent employment. And again, the economy radically shifted from family supporting jobs to jobs, again, a lot of it in the service sector, a lot of it being contingent, temporary type employment. So we were suffering from that before the pandemic. And what I thought was interesting is that we had just returned to levels of food insecurity that we had experienced 12 years ago prior to the Great Recession. And again, food and money for food is the most fungible portion of anybody's budget. You've got to keep your transportation, you've got to keep your housing. If you're medically or dependent on pharmaceuticals or medication dependent, you have to pay for your medicine. So the food budget is what's always sacrificed. And with rapidly rising costs, especially in the area of housing, transportation, and healthcare, that food had been getting crowded out for some time. So sound and effective public policy, making sure that the community supports and the social supports are there, certainly livable wages, access to healthcare, access to affordable childcare is really important for low-wage working families, and social safety nets for those who are unable to work through no fault of their own.
Appreciate that, and it's a lot of things that are happening. Finally, how can everyday Ohioans get involved to help make a difference?
Thanks for asking. One is we're always looking for folks to volunteer their time, their talent, their treasure. As I said, our network, 80% of our network relies on senior citizen volunteers. These are the most at risk. We need young people to come back. Again, social distancing, we're adhering to that, but we desperately need volunteers to come back. If you don't have time, do you have a talent that you can donate to us? Do you have treasure? Do you have the resources to be able to donate? And again, I always say, think about what you can do locally in your community. Advocate for sound and effective public policy to make sure that none of our friends and neighbors suffer the scourge of hunger and poverty. Get involved, be a part of the solution.
Excellent. Well, Lisa, thank you. And thank you for all the work that you're doing. Congratulations again.
Thank you. And if there's anybody out there that needs help, please go to www.ohiofoodbanks.org, get help. Help is available in your local communities. And again, thank you. It's a pleasure and quite an honor. Thank you.
Thanks. Ladies and gentlemen, we're going to take our final networking break of the day. Now, back at your tables, let's talk about what you're looking forward to this year in 2021. How are you and your organization planning to come together to support community activities, team build, or even raise funds? We'll see you back here shortly. Welcome back. Let's meet our second group of 5 Pillar Award for Community Service Award winners and our final group of award honorees of the day. To present them, please welcome Katie Janik, Vice President of Sales from Smart Business. Katie?
Thank you, Dustin. Let's meet our final 5 honorees, starting with Quantum Health. Quantum Health partners with nonprofit organizations that focus on improving the health, wellness, and vibrancy of the Columbus community. It is one of the most enthusiastic supporters of Life Care Alliance's annual gala, Big Wheels, sending employees to the event to inspire them to support Life Care Alliance's programs like Meals on Wheels beyond the event. Quantum even purchased a delivery van for the organization to help it reach more individuals. And in 2020, the company best exemplified giving back by continuing to encourage employees to remain active. While many companies discontinued or paused their Meals on Wheels routes, Quantum continued its route. That ensured that there was no disruption and allowed Life Care Alliance's focus to be on routes where recruitment efforts were needed. Quantum Health and its team members also donated personal care items to Life Care Alliance's Groceries to Go pantry, which serves individuals who are low income and living with active cancer. That's outstanding. Congratulations, Quantum Health. So next up, let's welcome Rev1 Ventures. Rev1 is a unique investor startup studio that helps startups scale and corporates innovate. Led by President and CEO Tom Walker, it provides the guidance, connections, and space needed to bring ideas to market. And by doing so, it is enriching the Central Ohio community as a whole. Rev1 also helps more established companies connect with the startups that matter to their organizations, providing exposure, access, support, and ultimately results. By working with investors to position Columbus as the Midwest hub for startup growth. Rev1 not only helps spur economic activity in the region, it also supports endeavors and events at its facilities that help strengthen the communities where we live and work. Rev1 and its companies have attracted co-investors from 26 states and 9 countries. Congratulations, Rev1. Congratulations, Rev1 Ventures. Next up, we want to welcome Sylvia A. Garrett and Associates Agency, LLC. From its inception, Sylvia A. Garrett and Associates Agency has returned a minimum of 10% of its profits to the community. Sylvia herself is an active member of the community and is a passionate advocate for positive change. Sylvia and her team have partnered with and contribute to numerous organizations focused on youth development, the arts, community, and economic empowerment, as well as wellness. Here are just a few examples from the past year in which SAG has sponsored or contributed to. So the Graduate of Women's Transition class at Dress for Success, in which women who mentored with professionals for over 12 months worked to transition from economically challenged environments. Spiceteria, which is an online gathering of women of taste and community that support empowering women. The YWCA Family Shelter with fashion designer Kiama Garrett donated over 200 protective, washable, reusable masks. And Envision Proven Success, an organization that provide knowledge and resources that empower women to improve their quality of life. That's outstanding. Congratulations. So now let's recognize the Pizzuti companies led by the Pizzuti family. The Pizzuti companies have been long-time valuable partners to the United Way of Central Ohio. This has been especially important during these challenging times. The last year, the Pizzuti companies launched a new program that provided employees who volunteered at the United Way funded partners with a PTO day for every 24 hours of volunteerism. In past years, during the United Way campaigns, the company hosted a spaghetti tower competition, pitting employees against each other to build the tallest tower from spaghetti and marshmallows. How fun. They also did a trash can pong on the roof, created by a giant replica of a pong board using garbage cans and basketballs. Each year, the annual United Way campaign ends with Kahoot quiz competition, a percentage of happy hour at the Joseph, and online silent auction. The Pizzuti family continues to invest in the community. It has launched new events, new fundraising activities, a platform for volunteerism, and continues to find ways to give back. Congratulations. Now let's recognize Z Promotions. Pre-COVID, Z Promotion staff gathered physically each quarter to volunteer time to local organizations. These events also allowed team members to relax and build their relationships outside of work. Then and now, CEO Kay Zelene Adams encourages her team to volunteer outside of work hours, whether it's virtual or in person. Every staff member has a different passion, and the company works to learn about those passions and find ways to make a difference and opportunities to support staff while they are helping. Current projects include helping sex trafficking victims, youth sports teams, and cancer leukemia survivor support. Assistance comes in ways by, sponsorship, time off to volunteer, and donation of items and care packages. Among the organizations Z Promotions have supported in recent years include Women Business Enterprise National Council, Women Business Enterprise Council Ohio River Valley, National Minority Supplier Development Council, and Ohio Minority Supplier Development Council, National Association of Women Business Owners, NABO Columbus, Central Ohio African American Chamber of Commerce, and Asian American Chamber of Commerce, the Conference of Minority Transportation Officials, COMTO, C-O-M-T-O Columbus. Just really do so much. Congratulations, Z Promotions.
Well, ladies and gentlemen, we have come to that time of the program where it's time to wrap things up. So congratulations to all of this year's Pillar Award for Community Service honorees across every category. We would also be remiss if we didn't take a moment to recognize the group from Medical Mutual and from Smart Business that coordinated this event behind the scenes to bring this virtual event to life this year. Pivoting, as you know, has not been easy. So thank you for your hard work. Now, thank you to our co-founding and title sponsor, Medical Mutual, and our supporting sponsors at today's event, DigiZoom and Ohio.net. Now, before you click off to your next video meeting, ladies and gentlemen, we encourage you to get involved in this community. And if you have just one inspiration from today's program, let it be the knowledge that despite our challenges, each of us has the power to adapt, evolve, and like the organizations recognized today, to make a difference in the community. So as we look ahead to what this year has to offer, let's stay optimistic. Let's continue to look out for each other. So have a great rest of the day, remainder of the year, and we look forward to seeing all of you here again next year in person in 2022. Have a great day.